For ReachMD, this is Audio Abstracts.
I'm Dr. Shannon Chang, a gastroenterologist at New York University Langone Medical Center and a member of the Crohn's and Colitis Foundation's Rising Educators, Academics, and Clinicians Helping IBD group, or REACH-IBD. Patients with inflammatory bowel disease are known to be high consumers of healthcare services, especially emergency room visits. In this current climate of healthcare reform, reducing inappropriate or avoidable ER visits is an important healthcare delivery goal. In a population-based study published in the December 2016 issue of the Inflammatory Bowel Diseases journal, lead author Dr. Zoann Nugent and colleagues examined the predictors of ER use for individuals with inflammatory bowel disease. This was a retrospective population-based health administrative database cohort, including patients with IBD in Manitoba from 2009 to 2012. The investigators considered a patient to have inflammatory bowel disease if that person had 5 or more healthcare visits with associated ICD-9 or ICD-10 IBD-related codes. Patients diagnosed from January 2009 to March 31st of 2012 without any prior codes for IBD were considered newly diagnosed or incident cases. All others diagnosed prior to this time were considered to be prevalent cases. IBD cases were matched to 10 control patients without IBD in the Manitoba registry. The primary outcome of interest was ED attendance. There were 300 incident patients diagnosed with IBD during the study period. Of these incident patients, 76% used the ER at least once during the study period. Predictors of ER visits within 3 months before or after diagnosis included having Crohn's disease rather than ulcerative colitis, and opioid prescriptions prior to diagnosis. In the prevalent cohort, 3,394 people had established IBD diagnoses. 48% of the prevalent cohort attended the ED at least once. IBD patients were more likely to attend the ED than controls and had longer stays. Of interest, just 8.5% of the IBD cohort accounted for 52% of the ED visits, demonstrating a small group of high utilizers of ER care. Patients with inflammatory bowel disease were more likely to visit the ER if they saw multiple physicians in the previous year, especially those with at least 5 physician visits. Finally, authors noted that after an ER visit for a GI complaint, only 52% of incident patients and 27% of prevalent patients were seen by a gastroenterologist within 1 month of the ED visit. This study highlights several important topics in IBD care. First, continuity of care is of utmost importance. Patients who had seen a gastroenterologist in the year prior to IBD diagnosis were less likely to present to the ED during the study period. Patients with IBD who saw only one physician were less likely to visit the ER. This data may suggest that patients who establish care with an IBD physician are able to more selectively utilize the ER. Second, a small percentage of IBD patients constitute the majority of ER visits. As this is likely the case at most hospitals, a strong focus should be placed on identifying these high utilizers and connecting them with an IBD care team to help prevent overutilization of the ER. If you are interested in this topic or others on Crohn's disease or ulcerative colitis, the Inflammatory Bowel Diseases journal brings the most current information in clinical and basic sciences to physicians caring for patients with IBD and investigators performing research in IBD and related fields. Each issue contains cutting-edge original basic science and clinical articles on diagnosis, treatment, and management of Crohn's disease and ulcerative colitis from clinicians and researchers around the world. The IBD Journal is the official journal of the Crohn's and Colitis Foundation. For more information on the Crohn's and Colitis Foundation, please visit www.ccfa.org.
This has been a presentation of Audio Abstracts. For more information and for reference links of this article, visit reachmd.com/audioabstracts.